Now, I have covered this topic so many times that I am going to end this topic once and for all. So from now on, unless there's some new epidemic to some new drug that's making people do really crazy stuff, I am not going to touch the subject again. But for those of you who have not seen my videos on addiction and drug addiction, I am going to rehash very briefly why someone gets addicted to drugs. Drug addiction, also known as substance use disorder, is a complex condition that can develop for a variety of reasons. Some factors that may contribute to the development of drug addiction include. Now, before I tell you this, I will briefly tell you again, I was a drug addict for 17 years. For 17 years, I injected meth on it, not every day for 17 years, but for most of those 17 years, it got to the stage that I was injecting every day, especially towards the end, and it got to be a very slippery slope. And I was also taught right at the beginning, 17 years ago, that meth wasn't addictive. Meth is one of the most addictive drugs you can ever use. And I was very lucky, although I got to be really thin. For example, if you look at me now, I weigh about 67 kilos. On meth, I weighed 47 kilos. So I was gaunt. I looked about 15 to 20 years older, and I just got to the stage of 17 years of having a couple of sores. I was lucky that if I had persisted, I'd be dead. I would not be here to share with you my story, and I am very grateful. So here I'm going to tell you how what some of the factors are that relates to drug addiction and how in my situation they affected me. Okay? So number one is genetic factors. Some people may be genetically predisposed to drug addiction due to differences in how their bodies metabolize and respond to drugs. That was with me. There is addiction in my family. My father was an alcoholic. He was addicted to sex. He was addicted to gambling and quite a few other, which we won't discuss. So I believe genetics is one of my causes. Number two, environmental factors. Exposure to stress, trauma, abuse, neglect, and other adverse childhood experience can increase the risk of drug addiction. Yes, I have borderline personality disorder, I have PTSD, and I was exposed to all those. So already I've got 2 out of 2. Number 3, social factors. Social pressure to drugs. Availability of drugs and peer influence can also contribute to the development of drug addiction. That happened to me. I had a friend who was using meth, and I thought, I can't judge them unless I go there. And then I was around other addicts and I had social peer pressure. So already 3 out of 3 for me. Let's continue. Number 4, mental health conditions. People with mental health disorders such as depression, anxiety, or post-traumatic stress disorder may use drugs to self-medicate and alleviate symptoms. Yes. So again, I relate. I have anxiety, I have PTSD, I have quite a lot of mental health, and I was using it to numb and to change my reality. So already 4 out of 4. Number 5 reason for why people use drugs: chronic pain. People who experience chronic pain may use drugs to manage their symptoms and develop an addiction. I too have chronic pain, but I didn't misuse my pain medications. I misused meth, and when I was high, I didn't feel pain. I felt great. So I could say so far 5 out of 5 reasons. I agree with every one of them. Number 6, lack of support. A lack of support from family, friends, or community can increase the risk of drug addiction. Well, fortunately for me, I had beautiful support. I owe so much gratitude, so much love to my family. But what happened is my husband, who's passed, we co-created and enabled each other in our drug addiction. And when the law caught us, there wasn't very much support in law. Instead, law wants to, or the police, the authorities, and the judge, and especially in Australia, instead of sending people to treatment, you go to jail. That doesn't treat your drug problem. So there should be a change in the way we look at drugs. So anyway, there's 6 reasons I have given you for why drug addiction occurs, and have shared with you that 5 out of those 6 reasons applied to me. It's important, however, to note that drug addiction is a treatable condition, and seeking professional help can make a significant difference in recovery. Treatment approaches may include counseling, behavioral therapy, medication-assisted treatment, and support groups. Unfortunately, for meth, you have to go cold turkey. And a lot of people feel shame in admitting they're addicts because we get labelled as junkies. But drug addiction affects every level of society, from the top to the bottom. So you're not a bum, you're not a junkie, you are not weak. There is no shame in admitting you've got a problem. That is strength. And I'm going to say, bow down to you and say, good on you for admitting you have a problem, because your life matters. It matters to me. Whether it doesn't matter to you, it matters to me. And those things that caused you to have a drug addiction problem can be overcome. For example, the last one, support. There is support out there. There's a group called SMART that I recommend. And I'm lucky. And plenty of people, there are sadly some people who don't have support, but there are drug addicts who do have loved ones who are very worried about their behaviour and want to help you. And social pressure, peer pressure, be strong. Say no. Because from the first moment you take that drug, you're hooked. I didn't believe I would be, but I'm telling you, take it from a drug addict. you're hooked. And once you become a drug addict, your brain is rewired. It no longer functions normal. The structure of the whole brain changes. That's why you need these drugs, because you are rewarding the reward centers of your brain. The brain changes and you have to have it. But you can break the cycle. I did it. I went cold turkey. And if I can do it, you can do it. But do it with help. Tell your doctor. Tell a counselor. Tell a friend. Don't be ashamed. If I can do it, look at me. I'm not ashamed. Sometimes what led you into drug addiction, well, we won't go there, but let's say something awful happened and you just don't want your life, you want to change your reality. Well, we all have awful things happening, and I am not in any way saying what happened to you was terrible, because it bloody was. But we need drugs. Don't help it. Drugs make it worse. We need counselling for what happened to us. We need trauma counselling. We won't get better using drugs. With that, I've said enough, and so this is the end. And I guess it's the putting together of all the drug addiction and trauma videos I've made. This is the concluding video. Thanks guys for watching. As always, take care. Be in the moment. Cherish every moment, because you never know. You never know when it's your last. I love you. Remember, you matter to me. And you matter. You matter. All right. Take care. Bye.